Anyway, my name's Terry.
Push the red button.
I pushed it. It's
I got it on
He's
there.
got it.
Yeah.
Anyway, my name's Terry Doran. I'm making a documentary. I'm a documentary filmmaker. I've won a couple awards, and I'm making a documentary about victims of this sick healthcare system. Susie Renfro will be in it. Several other people here. Eve, Dave Lambert. See a lot of familiar faces. What I want to say is, number one, I question whether Evan Bayh is a good man because his job is to represent us, period. I don't care what pressures he has. This is a representative government. If he doesn't represent us, we have no government, we have no democracy, we have nothing. And his wife taking money, that should be illegal. $327,000 last year, 2 meetings for WellPoint Board of Directors. What's her purpose? To make sure these horror stories we're hearing keep happening. That's the purpose of her being on that board. Let's just be honest. Then I want to say, I just saw last night that there's more soldiers in Afghanistan dying from lack of health care than they are in battle.
It's a shame.
Really? These are our soldiers. We don't even take care of our own soldiers. And
Support our
thirdly, I
troops.
just want to say, troops, that my brother Chris has been very ill in Australia, where he's a citizen. He just got a doctorate degree in sociology. He's a teacher. He's an activist. He was arrested in Seattle at the big protest, New York City, the Republican convention protest. He's a wonderful man, and I'm proud to be his brother. But my point is, Australia has national Medicare. Australia is like a poor cousin of the United States, like the little puppy that follows the big dog around. So, but it has national Medicare for all citizens, period. So Chris was in the hospital with his illness. All he had to do is sign a paper, all paid for. His doctor care, all paid for. Medicines, a little bit of copay, but otherwise no copay, no deductible. So really, why are we talking about a system where they're going to fine you to buy health insurance from companies, if you don't buy it, from companies like WellPoint, when we see there are countries like Australia where it works? Okay, thank you very much.
Okay. 1, 2, 3, 4. 1, 2.
Yes, I do. I do think that healthcare is a human right. I manage a restaurant. I would certainly go with a national plan because God knows the plan that's in place now is not working. And there are a lot of people who are not covered. I think it's a really good idea that businesses do it because, again, the healthier the worker, the more productive they're going to be. So it's to the benefit of big business to provide health care, but for whatever reasons, some of them don't. And when they do, it's so unaffordable that nobody can buy into it.
I'm a musician. I'm an independent artist, a freelance artist, and I am without insurance because I am a freelancer, and the freelance union is a little steep for an independent artist such as myself, and I've gone from job to job since graduating college in 2000, and each job lasted no more than 6 months, and as a result, never given me the opportunity to earn health insurance. Yeah, I'd love to have health insurance, but I can't afford it.
I'm covered by health care, but my dad owns a small business in Maine, and he doesn't have the budget to pay his employees health insurance, so.
I was diagnosed with Crohn's disease when I was a junior in high school.
I spent approximately 2 years in a hospital, during which time I had 9 surgeries, including bilateral hip replacements and several resections. For a while, I had double coverage under my father and under my mother, and that that accounted on paper, what I was told for, that accounted for everything. Even though I had all that coverage, we would end up with thousands of dollars in bills. I'm still dealing with collection agencies on a regular basis for bills from hospitals and doctors from times when I had complete insurance. And I wonder whether it's incompetence, or I think it's actually a mix of incompetence and them also purposefully doing that so that you give up. I think their goal ultimately is to get you to give up and just pay it. Because while it's a lot of money to you, or even if it's a little money to you, to them it's millions of dollars, because it happens all over the country.